This is Management and Leadership in Health Professions. The assignment is Management Action Plan. My name is Eze Njeribako. Instructor is Dr. Michel Abundo. Objectives. I'm going to introduce my organization, that's where I work, with a mission and a vision. Select one issue that I have presented earlier on in this class. Present the issue and provide a brief overview with contributing factors. Present two possible solutions to the issue and explain the best out of the two for the organization where I work. Select three of the core management functions and explain how they would be applied to implement solutions in the issue in my organization, and then conclude with a statement. I work at the microbiology department of ORMC, Orange Regional Medical Center. Orange Regional Medical Center is part of the Greater Hudson Valley system. The other is the Catskill Regional Medical Center. It is a 501c3 non-profit healthcare organization located in Middletown, New York. It's dedicated to specialty programs that include bariatric surgery, orthopedics, oncology, mental health, cardiology, community screening, just to mention a few, and also some medical programs that include emergency medicine, family medicine, psychiatry, traditional rotating internship, to mention a few. It is a 606 licensed inpatient bed hospital. The mission, the vision, and the values. Their mission is to improve the health of the community by providing exceptional health care. The vision is that the RMC they are caring professionals driven by standards of excellence who go above and beyond to provide an exceptional patient care experience. Among the values include patients and families first, honesty, integrity, transparency, operational excellence, teamwork, collaboration, communication, and accountability. One of the major issues that I see is the organizational issue. The major issue that I've observed is the lack of decentralization of the budgeting system within the departments. ORMC is part of a functional structure organization, and one of the major disadvantages is inadequate horizontal departmental coordination, and this can lead to slow decision making. So the budgeting system comes from one source. So in the departments there is always issues with supplies, because the managers and the supervisors are not given the free hand to do or to supply or to ask for supplies, for the departments that they manage. So I think that if they're given the free hand to ask for supplies, then production will be taken care of. And of course, that can lead to lack of motivation among staff. It will make staff not to be motivated to do their work properly, and that would hamper production. The major contributing factor to this problem, one, is culture. We look at culture, long-standing organizational culture, where some individuals play a subversive role to the leadership and the hierarchy within the organization, continues to permeate both within the organization and across professions, thereby curtailing the potential of evidence-based practice. So what I'm saying is, because it has been the culture there that the budgeting system must come from one particular source, then it becomes pretty difficult to let go of that culture. So it has been the culture, and then it becomes pretty difficult to stop that kind of culture of getting the budget from a central place. So that's one of the major issues that this lack of centralization causes. Now, a major solution that can help to solve this problem is change. Change is the only factor that can help solve the problem of decentralization of the budgeting system. According to Benjamin Disraeli, the British Prime Minister and writer, change is inevitable and it is constant. So that is the only thing that is constant is change. So change will keep coming about from time to time. So if we change the culture of having the budget come from one particular source, then it will help to improve production. Another solution to this will be support. Providing the necessary materials encourages the staff within the organization to fulfill their obligation. So if the budgeting system is decentralized, then there will be support for the managers to ask for materials for their departments, giving them the power, giving them the support to ask for materials department. Management functions. Out of the 5 management functions, I chose 3. The 3 are planning, leadership, controlling, and coordinating. Planning, as Olin described, is deciding what to do and how to do it according to Olin. In planning, we anticipate and prepare for tomorrow, not for the past or present. Planning leads to vision and goals of an organization. So you have to plan ahead for tomorrow, plan ahead for the future. So it's very, very important. Leadership is a process through which an individual attempts to intentionally influence human systems in order to accomplish a goal. So leadership is the process of making sure that people do the jobs to achieve the plans. This process can be done through theories proposed by some scholars. You have the trait theory, which examines traits and characters of leaders and how they contribute to leadership effectiveness. You think of the personal traits that make leaders to succeed, e.g. intelligence, confidence, and initiatives. Of course, we think about the skill theory, which examines skills and abilities of leaders and how they influence leadership. The skills could include technical skills for working with things, e.g. making health products and services, conceptual skills for working with ideas, thinking of new goals, and human skills for working with people, e.g. coaching new employees. Leaders can also motivate. You can have the motivational theories to influence people working under them too. These motivational theories could be content in which they focus on human needs and other unmet needs that the people need. And they have the process theories that focus on the context in which work is done and how people think and feel about the work. The third management function is controlling and coordinating. According to Dunn, controlling is an essential function for all managers by which they monitor performance and take corrective actions when needed. So controlling is the fifth and final management function as described by Henry Metzberg. Managers do three things to control performance. They set standards and expectations, monitor and judge performance compared to the standards and expectations, make improvements if standards and expectations are not met well enough. So it's very, very important for managers for these three functions to be able to lead to full production. In conclusion, the responsibility to implement evidence-based principles of practice and workplace falls on the manager, as the manager uses the three functions described above: planning, leading, controlling, and coordinating. The centralization of the budgeting system will help in making sure that managers are adequately supplied, or materials are adequately supplied to enhance production. And this is very, very important in the healthcare institution, because without it, then the central focus, which is the patient care, will not be met. These are my references.